All right, let's get into our first topic then. And is it okay to treat patients in hospital corridors? 0207 862 2222 is the number to get your calls and your stories in on this one. Now, senior doctors and nurses have warned that care for patients in hospital corridors has become normalised. Last year, 500,000 Brits had to wait on trolleys in A&E for 12 hours or more. Now, that was before hospitals were hit with the winter flu outbreak, which is expected to be the worst flu season for a decade. One hospital struggling with the demand has even advertised for a corridor nurse. Whittington Hospital in North London was reportedly looking for somebody who could work shifts in corridors when rooms overflow. Is this a good solution given the strain hospitals are under, or is it alarming to you? Have you ever been forced to wait in a corridor or been treated in one? We would love to hear from you and your experiences. Henry, what's your gut reaction to this?
Well, my gut reaction is, of course, I'd be a fool to say this is great, this is fine, it's good that it's normalised, but it's necessary evil. Because if they weren't being treated in corridors, where would they be? They'd either be at home, struggling, possibly dying, or in an ambulance in the car park waiting for 12 hours. Or they might be sitting on a chair, suffering with no possibility of triage. So if there is no other alternative, and clearly in hospitals up and down the country there is no other alternative, then that's what's got to happen. I mean, even during peacetime, i.e. without a great surge in flu cases, our population is getting older and sicker, and the average hospital is about 30 or so beds short. That's up and down the country, England, Wales, Northern Ireland and Scotland. And when you look at how many hospital beds we have per 1,000 people, in our country, it's about, 2.4 or so beds per 1,000 people. And that compares to, I know we're always slagging off Germany and France and whatever, but about 4.5, 4.8 in other countries.
Okay.
So lack of capacity means this is why we're in the situation we're in. It's not great, but what else are we going to do?
Maybe Henry's right. This is the situation we're in, and it's a question of, do you want to see a doctor in a corridor or not see a doctor at all, Geoff?
It's not it's not a long-term solution. It's dehumanising for the patients. I'm not saying you're in favour of that at all.
No.
But I'd imagine it's very difficult to administer care as well for the doctors and the nurses. You want that kind of privacy and the seclusion of at least a bed to stand by without people constantly going by you. But I think we've got to acknowledge how we got to this point. There was, during the pandemic, there was advice given which terrified people of going anywhere near any medical institutions. I know that it's absolutely true to say NHS waiting lists were going up before that, but from 4 prior pandemic to 8 million now. And also the lack of a solution on social care. Whether you call them bed blockers, whatever the phrase is now, the beds aren't free. Going back as far as when Labour got in the late 90s, they were going to sort out social care. Then the Tories failed to sort out social care. And then we've just had this Labour government, they're going to do a review, and when's the answer to that going to come? 2028. It gets kicked down the road again. So a big solution, if you talk, we haven't got many beds, you're absolutely right. How do you free them up? It's by getting people out of those beds and getting them home.
Okay, so we're in the situation that we are now, and both of you are in agreement with that. Henry thinks this is probably the best solution given the situation. What's your view on that? Is this the best solution, or do you think that we should be doing something else?
Oh, I don't know what the alternative is. I think a lot of people watching at home today would just be shocked that there's a word for it. It's one of those terrifying things. Oh, corridor care. It's like when I found out that they had a word for what happens when they lose a nuclear warhead. You go, I think it's quite disturbing that it's called a broken arrow.
Oh.
Yeah, but that's the point, is the fact that there's a preordained word for it. You go, well, obviously this is factored into our thinking now. And people will just be shocked, I think, that NHS care trusts are having to advertise. By the way, also, who's going to respond to that job that was advertised as corridor care? Hard enough being a nurse at the best of times. The idea of doing it in that situation is not appealing.
I think the other concern is, because I said there, you're either seen by a doctor in a corridor or not at all. Well, we don't have any more doctors on duty, so you have a finite amount of doctors, you have more and more patients, so the truth is, you might be in a corridor, but who knows how often you're going to get to be seen by that doctor.
We're massively short of doctors in this country. I mean, looking at medical staff across the piece, we're talking about 130 to 140,000, and this NHS work plan that the previous government announced, we've got no idea when it's going to be implemented. We've got an implementation crisis in the public sector in this country.
Let's go to the phones. Jill from Manchester, do you have any experience with corridor care?
I certainly do, yeah.
Do you want to tell us about it?
Yeah, quite recently I was in hospital and I was sat on a chair in the corridor, I was opposite a lady who clearly had dementia. She was in a gown on a trolley. She had no underwear on. She had no blanket. And she was thrashing her legs about, and I could see her private part.
Well, this is the point that Geoff brought up, is there's no dignity, there's no privacy for corridor care. Now, obviously, that's a really harrowing example, and obviously you're in there because you're not feeling well. That can't make you feel very much better. How long were you in the corridor for?
Oh God, it was probably more than 12 hours.
Oh my goodness. Do you mind me asking what you were in there for?
Oh, it was for a mental health problem.
Ah, okay. So that might be why you were opposite somebody with dementia as well. Maybe that goes hand in hand. I'm not entirely sure. But
one thing that does come to mind is the kind of sort of agility and nimbleness that we showed with the pandemic, with the Nightingale hospitals, which ultimately weren't used. You do wonder if just simply temporary structures that could go in car parks, just something, anything that could avoid what that poor woman on that bed opposite that lady experienced.
Well, obviously it's for the woman that was thrashing about, but also for all the other people that were in the corridor having to witness that when they're already under their own level of distress. And also, Jill, you're not on a trolley, you're just sitting in a chair. I mean, obviously, if you had a physical issue, maybe they would have put you in a trolley a little bit quicker. Do you accept, though, that this is the best solution hospitals can come up with, or do you think they should come up with another one?
They need to come up with another one. It's not acceptable. There's no dignity. I had to go and get a nurse to see to that lady because I just thought it was a complete loss of dignity for her. And they did eventually put a blanket on her and cover her up. But it was only because I spoke up. Yeah. And when I spoke up to the nurse, she said to me, "I'm so sorry you had to witness that." And I said, "Don't apologise to me, apologise to her family." Yeah. You know, if this was my grandma, I'd have hit the roof.
Yeah, Jill, thank you very much for sharing your story. I'm sure there's lots of people with similar ones out there. Thank you very much for your call. Susan from Worcestershire, do you have any experience in this?
I do indeed, Storm. About 6 years ago, about 6 and 7 years ago, I was taken into hospital twice, once with a broken wrist and once with pancreatitis. Both times I was left on the trolley. In fact, we made friends with people on the trolleys because they put it in bunches, and then we was moved off to another part where we could get some sleep. We couldn't get any sleep because we was moved again. The only care I got was from a utility nurse, and without him, I don't know what we would have done. He was absolutely amazing. I got no treatment. My pain when I broke my wrist was absolutely incredible, and trust me, I know a lot of pain. And I just got no help. When the doctor came out, he went, "Why has this lady had no painkillers?" I've been thinking about it, you know, it's like 16 hours.
Yeah, that's no good at all. And that was 6 years ago as well. So
it's not a new thing.
So it's going to be even worse for people now, and it brings in that point that, okay, we can get trolleys, we can use the corridors if that's what we want to do, but actually we need people to see the individuals in the corridor. Also, corridors are quite brightly lit places, they're very noisy. Was it possible to get any sort of rest when you were there?
No, they kept moving you as well. It's like, to be honest with you, the pain I was in, I just went and sat in the day room, or the night room at the time, because I just couldn't do anything. It was awful, absolutely. There was a poor man behind me who was dying. They actually moved his family out and left him with no family. I was talking to him.
What do you want to see happen very quickly, Susan?
I just think we've got to get more nurses in and, you know, give them the money they need. And, you know, they really, really, really do work hard, really work hard.
I mean, Susan puts her finger on something important. Sorry, Susan, to interrupt you, but you've really painted a vivid picture here. Because in the end, we can have all the AI, all the tech, all the equipment, but in the end, it's human beings who have to provide the care. The reason why that woman wasn't given any painkillers or whatever was because there was nobody there. Oh, sorry, you weren't given any painkillers, Susan, was because there was nobody there to talk to, nobody there to actually take care of you and actually say, "Oh, she needs help. I'm going to go over and get this medication and give it to you." If that person isn't there, it's not going to happen.
Susan, thank you very much for your call. Stephen from Cumbria, what's your experience of corridor care?
Absolutely horrendous. I was taken into A&E. They put me in a cubicle. and I was in majors because I'm terminally ill.
Okay.
And then they basically just took me out the cubicle and threw me in the corridor. There was actually other patients being treated in the corridor, and I was just left. I ended up after 16 hours walking out.
Oh, Stephen. So did you try and get a doctor's attention? Because there must have been quite a lot of people walking up and down the corridor.
Yeah, I did. They actually, on the way out, they said, "Oh, we're going to come and see you soon." But my daughter was seriously ill. And I said, "Well, I've got to go because, you haven't treated me." I got absolutely no treatment whatsoever.
It's
I was
odd
put in a bed.
It's odd that they put you in a cubicle and then brought you out. That tells me that they must have been triaging, and actually, even though you're terminal, I'm really sorry to hear that, Stephen, there must have been other cases in there, oddly more, and rather unfortunately, more severe than you. So that just goes to show how stretched the hospitals are. Do you have any sympathy for the nurses and doctors?
I'm not being funny, but the gentleman that put in my cubicle was a lot less seriously ill than me. He was just older.
Well, I mean, I can't comment on that. I have no...
no, obviously.
Medical training, and I also wasn't there, but I appreciate that must have been terribly distressing for you, and the fact that you had to get up and leave.
They put me in a corridor, and what was really annoying is they were actually treating patients in the corridor.
Stephen, though, the other option is they don't do corridor care. They have a policy against corridor care, and every single person that you saw being treated or not being treated in your case wouldn't ever got a possibility of seeing a doctor. You would have just been left to wait in an A&E, a very overcrowded A&E with germs and bacteria at the moment spreading all over the place for days potentially. Would that have been better?
I'm not too sure because I said the way they treated me, it was absolutely horrendous. I never even got to see a doctor.
Stephen, I'm really sorry.
In the amount of time I was there.
I'm really sorry to hear your experiences with that. We're not getting any positive calls anyway about corridor care. I'm not sure we're surprised by that.
The one thing I would say, these stories percolate, but everyone will soon know a friend or relative that's been through that. The NHS does get a lot of money. It's getting more money. This Labour government, one thing they have done is committed money. I think it's going to be really important where that goes because, this government are embattled in terms of how the economy's going. If they can deliver on an improved NHS, that will mean something to people, but it's all a question of where that money goes. Or avoiding it is like Henry says, you want more beds, you want more nurses. If it gets swallowed up in other things, people are going to start to really kick off.
Well, the way they're going to get more beds is to tackle the social care, and that seems to be something that's not going to happen for, as you said, a couple of years. Jessica from Bridgend, what's your view when it comes to corridor care? Is it our best alternative?
So I'm a little bit torn, to be honest, because we've just spent, I think, about 36 hours with my dad in A&E after finding out he had a heart attack. 17 of those hours were in a corridor. So, I mean, the alternative for my dad was that he comes home and maybe has another heart attack. So, yeah, I'm kind of conflicted because I don't think the care that he received was at all up to standard. I think he went a good couple of hours between anybody even sort of checking his blood pressure. But again, like I said, I mean, the alternative was that he comes home and has a heart attack at home where there is nobody around to sort of see him. So I am really torn because I think it's really important that he was there, but obviously he was also there.
I mean, it does
surrounded by a lot of flu.
It does sound, Jessica, that weirdly he was one of the lucky ones because it appears that there's lots of people in those corridors that aren't seen by anybody. So a couple of hours, even though that's not ideal, is better than.
But one thing you do wonder is you totally understand like emergency staff prioritising certain people. I don't understand what's a bigger priority than a heart attack. They need to be attended to immediately, monitored immediately. Absolutely, total sympathy for NHS staff on the front line under pressure, but there's still aspects of patient delivery that have to happen no matter what the context is.
I mean, I would agree. It's not like any of the people that have been calling in with small matters, a grazed knee.
But a heart attack, 2 hours without having your blood pressure taken, that is negligent. Yeah,
it's pretty bad. I mean, I'm old enough to remember the days when we had all these different tiers of hospitals, regional health hospitals, strategic health authorities, and then every few years they reorganise and reorganise and they consolidate, and there's fewer and fewer big hospitals. And if you can't get into that big hospital, there's nowhere else to go.
I think that's what people are finding, is there's nowhere else to go. Jessica, thank you very much for your call. Derek from Exeter, what's your thoughts on this? I believe you're a doctor. Derek.
Hopefully Derek's going to agree with what I said, that we've consolidated and we've closed too many facilities.
I'm hoping... Oh, Derek's just gone. Stuart from Cheshire, then, what's your view when it comes to corridor care?
It's not ideal, especially in today's society with mobile phones, people filming for click likes. It's a privacy invasion.
Stuart, I hadn't even thought about that. I think you would hope if you were in A&E, the last thing that would be on your mind is filming something in order to get a few likes on social media. Is that something that you've experienced?
No, but I have seen that similar sort of thing on social media. You see ambulances treating people on the pavement and then someone appears with a mobile phone.
Well, that I can understand a little bit more, because that's just a pedestrian. But if you are
corridors, public areas.
If you're in a corridor in A&E, you either have a loved one that's incredibly ill and your mind would be elsewhere, or you are, in fact, yourself incredibly ill. But the issue with privacy is obviously a big one, as we heard from our first caller, Jill, this morning. There's certain people that maybe just shouldn't be treated on corridor wards. But Stuart, thank you very, very much for your call and bringing that up as a potential issue.